Hello, my name is Cushla Ford. Welcome to this session. Let's start with some definitions. What does health mean? Is it the same as well-being? There are, of course, numerous definitions, experiences, and opinions on this, and we're going to share with you what we mean by health and well-being in the context of the Healthy Campus movement, which in turn uses definitions from the WHO and Ottawa Charter. We'll mention the Ottawa Charter again later. For now, let's define health. Health means everyone achieving his or her potential to enjoy complete physical, mental, and social well-being. Healthy people contribute to the health and quality of the society in which they live, work, and play. Health is much more than an absence of disease or disability, and individual health and that of the country affects the quality of everyone's lived experience. Health is an essential resource for everyday life, public good, and an asset for health and human development. That definition was informed by the WHO and Ottawa Charter and taken from the Healthy Campus Framework document. And you will have noticed that well-being is part of it. Well-being is part of health and reflects the quality of life and factors that can influence quality of life. Sometimes we think of health and well-being and we think of being free from illness. I'm well because I'm not sick. These definitions challenge you to change that focus and to think about what makes you well, rather than what can go wrong. Another word for this is salutogenesis. Breaking that up, it simply means the genesis or origins of health. In other words, what leads to health? Rather than thinking what causes disease, ask yourself what causes health. What leads us to thrive and achieve a good quality of life? What supports us to achieve the definition of health and well-being that I just shared with you? As we progress through the sessions on this course, we will ask you to reflect on how your campus can support your health and the health and well-being of those you share it with. We will ask you to consider how that support can move beyond your campus to affect positive change in your community, country, and planet. We'll challenge you to ask yourself how you can help to realise that. The Ottawa Charter was developed in 1986 during the first International Conference on Health Promotion organised by the WHO. The emblem here outlines the 5 pillars of the Ottawa Charter. It's been updated several times to remain relevant with changing global contexts, but remains a wonderful and, in my opinion, increasingly relevant resource. The key concepts are that health is a resource for everyday life, not just the absence of disease. It emphasises the importance of participation and empowerment in health promotion, addresses social determinants of health for comprehensive health improvement. The Ottawa Charter remains a foundational document guiding health promotion efforts worldwide, and its principles are essential for achieving health for all and reducing health inequalities. And you'll see that it underpins the Healthy Campus movement. Now, it's all well and good to define health, but it is something else entirely to understand it or to go and enhance it. That is because it is a complex system. Campuses are also complex systems, and if you put both together, it can get very interesting, so bear with me. Let's start by looking at the most commonly stated dimensions to health and well-being as referred to by the WHO. These are physical health, mental health, social health, spiritual health, emotional health, environmental health, occupational health, and intellectual health. That's 8 dimensions. It's already a lot. And when we think about how these interact with each other, and then add in the beautiful variable that is human behaviour, and we do this in the context of the challenges we now face of climate change, biodiversity loss, economic inequality, and global health, you can see that we are not dealing with a linear relationship here. We therefore acknowledge that it will not be easy to achieve a healthy campus. The term whole system approach will be used a lot in this course, so let's break that down. First, what's a system? A system can be thought of as anything where components exist and interact. In complex systems, they tend to interact in an irregular fashion, they don't always follow the same rules, and they're not easy to control. For example, my decision earlier today to choose whether to cycle or to drive to work was influenced by the safety of the route for a cyclist, the traffic congestion on the roads I take, my access to a car or bicycle, the weather, the cost of fuel, my recent education in sustainability, the fact that I had to also arrange transport for dependents in my family, whether my day was going to facilitate being active later on, parking facilities, the list goes on. This is one small example of how complex a seemingly banal decision around health choices are. Now, if we take that onto the scale of a campus with thousands of people all interacting in different ways and being influenced by different factors at different times, you may question how we would ever achieve anything such as promoting an active lifestyle. But it can be done. Take a step into the grey and try to unravel the knots. There are local things that can influence complex systems, such as providing safe lanes and parking facilities for bikes. There are short-term actions that can be taken, which may not lead to sustained change, but are nonetheless factors that can influence a complex system. For example, having a week where those who commute actively are provided with a free breakfast. There are upstream actions we can take to shift people's priorities or perceived priorities and abilities, and we can also use information and education to influence complex systems. If you have a tendency to perceive the glass as being half full, like I do, you consider the many interaction points as leverage points, points where change can be made. These interactions can be points where access is possible to effect change. Let me use the example of obesity. Initially, when we as a community started to tackle obesity, there was a theory that the solution should be simple. That with the exception of some rare disorders, this disease was due to an energy imbalance, with calories consumed being in excess of calories expended for a prolonged period. Simple. The solution is therefore to reverse the balance and ensure that expenditure is in excess of consumption, and the process should reverse back to a healthier BMI. This makes perfect sense. Unfortunately, it does not take a systems-based approach. It does not take the complex interactions at play into account, and therefore it does not work. In reality, when research started to mount in this area, we realized that it was not as simple as a balance with calories in on one side and calories expended on the other. There are, in fact, over 100 proven variables that contribute to obesity. And we probably don't understand all the variables yet. So were we really that surprised when obese people did not lose weight when simply advised to eat less and exercise more? There are great efforts out there to promote health on campus. There are numerous, varied, colourful and very great fun efforts out there. We applaud these, and I often say that we need to add all the 1% together. So if you're part of an isolated initiative aimed at improving health in any way, I say, well done. We need to stack those 1% in our favour. But as we progress through this course, we will challenge you to push beyond isolated efforts. We will encourage you to ask difficult questions like, is this really going to lead to meaningful change? Is it tackling the root cause of the problem? Is it what's needed? And we will ensure that you are not the equivalent of the person who simply gives advice to someone living with obesity to eat less and exercise more. Because this task is not as simple as it may seem. Complex systems rarely have a leverage point which can change the whole process in one direction, a kind of silver bullet. But some alterations are more effective than others. You think of a circuit with various positive and negative feedback loops, like the one presented in this picture, you'll soon realize that if you move one component or direction of flow towards your ultimate goal, there will be change, but it's unlikely to affect the entire system. It may be ineffective overall. This can happen in the area of health promotion. If we zoom out and connect the dots, we realize that there's a lot at play. We can try to saturate the process by making lots of small changes. That could be effective. We could also look for a change that leads to several knock-on effects, adding momentum to our desired goal. As you can see, a whole system approach is not necessarily the easier option, but it is effective and it is achievable. We don't discourage targeting a single stream on a complex diagram. All the 1% can add up. But we do encourage consideration of other possibilities and acknowledgement that there is strength in a whole systems approach. Let me use another example and try to illustrate what we mean by a systems-based approach. Senior management in 2 institutions were approached and asked what their institution does to support mental health on campus. Institution 1 holds a week every year where they highlight mental health issues and signpost to resources to support those with mental health concerns. Media coverage of events taking place during this week, which are mainly organised by student societies, is encouraged by senior management and has previously received national level coverage. There are also services for those suffering with mental health conditions. These include counselling, connected referrals to local healthcare services, and links to self-help tools about dealing with exam stress, time management and study skills. Senior management recognise that there's a lot of mental health issues among young adults generally, including students attending the university, but does not feel like it's the responsibility of the university to manage this. Their role is to provide education so that their graduates can access good employment. Institution 2 states openly that it values emotional well-being, supports equality, diversity and inclusion, and recognises the importance of health for all. Health is mentioned as part of its core objectives. There are established structures and practices in place which run all year round and have become normalised in the campus community to ensure that staff and students are connected both within their peer groups and with each other. This fosters feelings of connectedness. There are several means of communication and interaction with senior management, enabling staff and students to stay informed about key issues related to their life on campus. Efforts to ensure emotional well-being were shared through a central health coordinator with those working on the university grounds, who teamed up with academic staff and students to plant and care for flower beds and trees in quieter areas of campus, to ensure that those using the campus have the potential to benefit from the positive effects of nature. There was initial reluctance to establish flower beds as they require a lot of care, but when links were made to the institution's policies on health and evidence provided linking nature with positive health outcomes, the hesitations abated. The health coordinator also ensures that nutritious, affordable food is provided on campus. There are also professional services for those with specific mental health needs. Institution 2 believes that supporting the health of their staff and students will lead to improvements in their output and is linked closely to their most traditional core objectives in scholarship. As you can see, there are different approaches in each institution, with Institution 2 considering a more whole systems approach. Institution 1 is siloed, considering mental health to be tackling the problem alone, without looking at the causes or mental health in the broader context, including for staff as well as students.